Hello and welcome to Decentralized Health Administration at Ubrica Project. My name is Dr. Macharia Waruingi. I bring to you critical knowledge about creating perfect conditions for much needed revolution in the health industry. Under these new conditions, universal health access will be possible. Everyone in the world, including you and your loved ones, will have access to best health services available, and it is possible within our time. Health for everyone will be of the highest quality there is in the world and will be affordable to all. I come to you each and every day from Ubrica Project, located at 1.4 degrees south of equator and 37 degrees east of the central meridian, exactly 6 p.m. East African time. So if you're available, we can be together online every single day. And I promise that I'll be there for you to discuss about how we decentralize the health administration so that we can have good health for everybody in the world. Today, I have great things to discuss with you. And big topic that where we get started is the origin of global health. This information is coming from a Decentralizing Health Administration, a textbook under development by the Ubrica Research and Development Team led by Susan Nyabura Jogona. Okay, so it's a very, very important textbook that's coming out. Maybe it will be in stores by December of 2019. Let's first talk about the basics. What is the Ubrica project and what does Ubrica project strive to do? Ubrica project strives to solve three fundamental problems of health production in the world. Three problems. Problem number one is the problem of lack of access to health services. Lack of access to health services. Problem number two is the problem of poor quality of medical services, maybe all over the world, but this poor quality is seen in African countries like where we are today. And of course, the high cost of medical care. Medical care is very expensive in Africa, particularly here in Kenya where we are. And when medical care is expensive, it doesn't mean that it's of good quality. It still takes you out. Now, lack of access occurs due to two issues. Issue number one is that people do not have money to go to the hospital or to the clinics. When people don't have money, they cannot go to the clinic, and therefore they do not have access. So we can solve that problem by helping people earn money. Number two, people can fail to have access when there are no hospitals to go to. And of course, that means that you can increase access by building more hospitals and clinics. But then those poor hospitals are still having poor quality medical services. So how do we improve the quality of medical services, maybe in the developing countries? Poor quality of medical services occurs when we don't have good knowledge to deal with medical problem, where medical knowledge is scarce, like we have in many, many developing countries, and particularly here in Africa. Then the quality of medical care is going to be very, very low, even if it is expensive. And then, of course, the high cost of medical services occurs when the local manufacturing is stifled. We cannot manufacture the things that we need to solve the problems of everyday life. So to solve the access problems, we create an online retail store where local people can post whatever they produce and they can sell them, much like any other retail store like say Alibaba or like Amazon.com. So sokojanja.com, spelled as SOKOJANJA.com. SOKOJANJA.com is online retail store where anyone in the world can sell what he or she has produced to increase the earning power. Money in the pocket means realized access to healthcare. And then, how do we increase physical access? We propose to build a lot of clinics. Ubrica Hospitals and Clinics project will ensure physical access to health services. How about the knowledge itself? Building university science and technology parks, science and technology parks or STPs next to every university will help create places for translation and commercialization of new knowledge relevant to ensuring the best quality of medical services in the world. So you see, it's doable. Then to reduce the cost by manufacturing products locally, what do? We create a biomedical industrial city right here in Africa. In the heart of Africa, they said we are 1.4 degrees north of equator and about 37 degrees east of the central meridian. That puts you right in a suburb of Nairobi, Kenya. And so right up somewhere near there, we get many, many acres of land and we propose to have a biomedical industrial city that will promote local manufacturing of biomedical products, reducing cost of medicines and medical devices, and therefore health services in general. The cost of health services will decrease in general, making health affordable. Now, how do we do all these things? Of course, it takes a lot of money. Number one, we have cryptocurrency for universal health access, UBN or Ubricoin. Ubricoin will help to underwrite all these services. Ubricoin is a utility token that will be built used in a Ubrica ecosystem. It's an ERC20 token built on Ethereum blockchain. Okay, so you can support universal health access yourself by getting and adding Ubricoin to your portfolio of cryptos, or by getting equity in a Ubrica project. Get involved, because this means a lot. It means that we can have universal health access for everybody if we worked together. And this, by working together, number one is buying the cryptos. Number two, particularly getting in the crypto environment, because cryptos are as clever as viruses. They are boundaryless, they go everywhere, and it means that they are uninhibited, they are uncensored, and it can now help to gather a lot of financial power needed to build access to health services for everyone in the world. And then we have universal health coverage. I tell you what, the big organizations in the world, such as the World Health Organization, they have been talking for years about universal health access. In Kenya right now, we have a very big talk about universal health access. Let me tell you something, ladies and gentlemen. Universal health access is an illusion without money. And this is why we build UBN, Ubricoin, because Ubricoin will help to reach very many people and create an ecosystem of users. And then all that money is used to build capability for universal health access for everyone. Now, if this is the first time you've had this video, smash the like button, and of course, we like that so that we can let our community grow. This is a community of decentralized health of administration, because health is centralized from the word go. And now we have the technologies to decentralize health. Now we have the decentralized ledger, we have the blockchain, we have the cryptocurrencies, also to decentralize the health financing. So in this channel, we shall be discussing a lot of those. How do we leverage the new technologies to decentralize health, to decentralize the knowledge of health? As you know, that the knowledge of health today is centralized in few locations. Let us say, if you went to Boston, you will find a very good quality, highest, best medical services right there in Boston. But step out of Boston and go to smaller towns in Massachusetts, the quality of medicine is not the same. Why? Because health has not figured out how to get out of one major hospital and go to the other. And this is the health administration itself. It's very, very highly centralized. Doctors are not able to share their knowledge worldwide. They're not like in engineering and manufacturing, or maybe in computer science, where Google in computer science is able to share its knowledge throughout the world. And so we can use Google services. Right now, I'm here sitting in Nairobi, and I'm using services provided by Google all the way from California, and we are able to talk to one another and even see each other. It is not the same in medicine. You cannot sit in Boston and then help people in a village in Kagodoine in Kenya. You can't, because in healthcare, we like to sequester knowledge. I'm going to tell you how this occurred. It is a very, very big flaw in the design of health services that came from how the global health, the idea of health in the world came about. And this is why Miss Susan Nyabura Jogona and her research and development team at Ubrica are working on a book to decentralize health administration, so we can have better concepts. And how do we use the decentralizing technologies like the blockchain and cryptocurrencies and decentralized ledger and all that stuff to make sure that everyone has access. And it is quite possible in this generation that everyone has access to the best quality, affordable medical services in the world. To understand the concept of global health, we should first understand where it came from. Global health dates back in the 18th century. It was referred with different names until 1997. So the term global health has not solidified until 1997, when the Institute of Medicine produced a report Now mentioning the word global health. So the rise to prominence of the term global health has occurred in parallel with popularization of the term globalization. Globalization is an enhanced awareness of common vulnerabilities we have and a feeling of increased shared responsibilities for inequities or inequalities present in the world today. The concept of global health um, has has changed greatly since the beginning. Infection control. I talk about infectious diseases, bacteria, viruses, and parasites and the kind. Infection control and delivery of healthcare remain important core features of global health. In earlier centuries, disease was more readily identified as only the plight of the impoverished and the immoral. Mhm. The rich people are not supposed to get sick. Yeah, of course. But of course, we didn't have treatment. They also got sick. Bubonic plague, for example, has been regarded as a disease of the poor. The wealthy could retreat in the country estate and, in a sense, quarantine themselves. In urbanized 19th century, it became obvious that the wealthy could not escape contact with the poor. And I can tell you this is a story in Nairobi. In Nairobi, Kenya, the wealthy and the poor coexist. Let me give you an example. When the wealthy guys live in rich suburbs, who do they employ to cook for them? The poor people from the slums. So it's now quite possible to find diseases like cholera in rich, posh neighborhoods. Even in big hospitals in Nairobi, you will find diseases that should not be found among the rich people occurring, because these rich people have employed people who are not so rich, and those people who are not so rich don't have good housing condition. They go back to where they reside in the evening, and they quite possible they don't have good. There's no good sanitations. There's no running water, and of course the place is just a mess. If you have been to Nairobi, you have seen that we are leading in the slum environment. We have the biggest slums in the world. Eh, biggest slum. We're not proud of that. That has to go. We have to put our hands together and make sure that we don't have people living in the slum in this century. Why? Because cryptocurrencies can help to eradicate that. Those people living in the slums do not have access to money. They don't have access to loans, they don't have access to debt, and so they cannot build nice houses, and they don't have access to jobs, and of course it's very, very sad. So we have spread of contagious diseases within such squalid living environments. And then it doesn't mean that these people don't go to work in a rich neighborhoods, because rich neighborhoods have people who need services, like they need nanny services, they need cooks, they need kitchen workers, they need gardeners, and of course they also go to work in big restaurants in the city of Nairobi. So that is not good. Let's go back to what happened in global health. Epidemics such as cholera, which is happening in Kenya, but they're not really epidemics. Sometimes the big cities you hear as part of emergence of cholera in certain places, and then big reports. But the in 1800 is what Europe was suffering from. So we have to take Africa out of the 18th century Europe and bring it to the 21st century world. Okay, we have to do that because these diseases are spreading to other people. Now, you cannot have infectious diseases coming, making epidemics in Africa and other places in the world, and then people board the aeroplanes and go to other places. So this is not a small problem. It is much big problem. As you see, rich neighborhoods in Nairobi are able to get diseases, with good sanitary conditions. They're able to get diseases from impoverished people who come to work for them. Similarly, wealthy countries will get diseases from impoverished countries unless we get to work this together. Yes, and of course, we cannot work on these issues with the centralized global health structure created today. And today, I just want to be very brief and very quick and show you how we got there. So epidemics such as cholera, yellow fever, and plague, they saw to the 10th International Sanitary Conference, which met in 1851 at the end of the 18th century. The conference deliberated upon quarantine regulations to deal with epidemics. The quarantine and disease isolation became a way of containing diseases. Quarantine and regulations. Cholera epidemics in Europe between 1930 and 1847 were catalysts for the intensive infectious disease diplomacy and multilateral cooperation in public health. This led to the first International Scientific Conference in Paris, physicians and diplomats from 12 European countries. I mean, I'm saying European, there's no African there. 12 European countries, including Australia, France, Great Britain, Portugal, Russia, Spain, Turkey, and of course, 5 states of what became Italy attended. And you can see Australia is included in European countries. No, it's not Australia, it's Austria. So we say Austria, France, Great Britain, Portugal, Russia, Spain, Turkey, and 5 states that became Italy who attended the meeting. The purpose of the conference was to create international code for containing epidemics using new methods of public health so that the nation's trade and citizens could be protected. I feel like right now we need an international code for containing epidemics that is built on the new technologies, blockchain technology, artificial intelligence, crypto economics, cryptocurrencies, and that's where we need to go. So the international health regulations created by the first international sanitary regulations or international sanitary conference were adopted at that international sanitary conference in 1851, and in 1869, the international health regulations were primarily intended to monitor and control six big problem, six infectious diseases. That is cholera, plague, yellow fever, smallpox, relapsing fever, and typhus. This is where we went wrong. We cannot just handpick diseases. And of course, because of that, the development of health organizations in the world have created these vertical disease pointed or disease driven projects to solve the global health problem. It doesn't work. So cholera becomes important. Now we hear about HIV, TB, malaria. Like those are the only diseases that can affect people. Then all these other diseases crop about, and then there's no money for them. Let us focus on looking at the health of a human being as a whole. That's what the Ubrica project is about. You cannot just look at 4 or 5 diseases and say that you have covered everything. Now, with decentralized technologies, with cryptocurrencies, we're able now to direct money to take care of all the diseases, not just 6 diseases, not just the 3 big diseases. They call them 3 big diseases. In my view, there is no disease that is bigger than the other. All diseases are equally big because when it consumes you, it consumes you. And of course, if you have malaria, so considered a big disease in global health, of global health concern, malaria can knock out your kidneys. Then you get renal failure. Now, what is renal failure? A small disease? No, it means that kidney failure can occur, and of course, other diseases can provoke other ones. And it is not only people who have malaria who are important. It's not only people who have TB who are important. It's not only people who are trying to deal with AIDS and HIV who are important. Diseases are equally important, and that's why this whole idea of global health need to be decentralized. And of course, one of we from those sanitary conferences, we had emergence of Pan American Health Organization. The Pan American Organization was formed in 1902. The Pan American Health Organization became the first permanent international health organization. The functions of these organizations were largely concerned with quarantine. Again, what about prevention? We didn't think about prevention until very recently. So quarantine and treatment of people who are sick, these are how we went wrong. And so we built these big hospital systems, which are outside of the population. They're away from the population, and the population gets sick. Until when you get sick, you don't go to the hospital. Okay? And I guess that's where we went wrong again. So number one is we went wrong by just looking at a few diseases, which we have carried all the way to the 21st century. You hear many people designing these global health projects looking at 1 or 2 diseases. You cannot take care of the population by just treating 1 or 2 diseases in that population. No. And of course, that means that money needs to be distributed across the board to think across all the diseases instead of money just being distributed to 1 or 2 or 3 diseases, as we saw in the beginning, what happened to after the international health regulations. Now, the Pan American Health Organization fell into the same problem, and it meant that the healthcare became siloed. Now, although the Pan American Health Organization said they promoted universal health coverage, it has never happened. Even in the United States today, we don't have universal health access. We don't have universal health access. We don't have universal health coverage, and this is because of the the mistake, you could say, the fault in the design of health itself and how it is produced. So let's mention a little bit about the League of Nations. League of Nations is a group of guys, those nations in Europe who get together. They were very instrumental in colonization of the African continent and called the Scrabble for Africa and all that, yada, yada, yada. They established a health organization in the League of Nations in 1922. The League of Nations Health Committee and Health Section were established under the leadership of Dr. Ludwig Large Command. I guess these guys were interested in creating a health desk in the League of Nations because of the diseases they were fighting in the new colonial states that were creating. Of course, in Africa, malaria killed quite a number of those guys, yellow fever, and of course, maybe I don't even know whether Ebola existed those days. It wasn't there, but we had infectious diseases happening. So the League of Nations got together, and Ludwig himself, Raj Command, became the secretary of the newly established Health Committee and the director of the Health Section, and the health program was initiated with participation of non-member states such as Germany, Soviet Union, and the USA. So the health organization is inspired by the idea of equitable provision of health and welfare that could reduce internal social conflict within each of the countries participating in the League of Nations, and then of course help prevent international wars. Well, how successful? The United Nations was later formed in 1945 after the Second World War. Yeah, of course, the League of Nations was not successful in preventing wars. So we had, the League of Nations came after the First World War. Now the Second World War, we're having the United Nations replacing the League of Nations. And it was created to maintain international peace and security, developing friendly relations among nations, promoting international cooperation, social progress, better living standards, human rights, and harmonizing the action of nations. You see, all these things are good things to say, but where is the money? Who is contributing the money to do all that? So when diplomats met in 1945, one of the things they discussed was setting global health organization. Now that's going to come away from the health desk of the League of Nations to a global health organization. After the demise of the League of Nations, the World Health Organization came into play. So WHO was created in 1946. The UN formed Parliamentary Technical Committee of members who met in Paris in 1946 and promotes formation of the WHO. The Technical Committee created the operations, principles, functions of the WHO. That's the World Health Organization, and all approvals for the WHO were met on on April 7, 1948 in Geneva. Geneva was selected as the headquarters. The mandate of the WHO was to conduct biological standardization, epidemiology notification service, classification of diseases, and establishing cause of death. I have to say that the WHO has made major progress in these areas and made significant achievement, but it hasn't done all. So now, the healthcare system in the world emerged as a centralized organization where international agencies made big decisions. So from the WHO, there came so many UN agencies, and then of course, these guys started out handing out instructions to government. Of course, we became independent like here in Kenya in 1963, and so the WHO would come and help to establish the Ministry of Health. And so the WHO gives instruction to the Ministry of Health, gives us a prescription of what to do about health, and we are supposed to implement that. So the government was supposed to implement these decisions, and as a consequence, health provision became this vertical, big brother WHO, or let's say big uncle, coming to give us instruction, and of course, the local health administration failed to develop. The localized, and while it's, of course, government is supposed now to be in charge of health. Health administration is therefore the job of government in literally all the world. Here in developing countries, in poor countries, the government is right there and doing, and of course, health is seen as a jurisdiction matter. Well, it is comforting to think that governments will take care of us in our jurisdictions. Diseases do not obey national boundaries. Diseases migrate from country to country uninhibited. Emergence and spread of diseases is decentralized and boundaryless. So we need a technology that can match that, that can match boundariness, that can match distributed structure or the distributed nature of diseases. And of course, blockchain technology and cryptocurrencies have similar characteristics. Due to blockchain's accessibility, distributed nature, and censored and controlled nature, it is most fitted to ensure universal health access. So, ladies and gentlemen, we're going to stop there because it's getting dark here in Nairobi. And of course, electricity doesn't come as easy as you may want. But remember that we can solve these problems by using distributed ledger technologies. We can redefine health administration, this decentralized health administration using the blockchain technology, and that's why we are. Remember that Ubrica project strives to solve three fundamental problems of health production in the world. That problem of lack of access to health services, poor quality of medical services, and high cost of medical services in the world. And we said again that Sokojanja is the online retail store where anyone in the world can sell what he or she has produced to increase the earning power. More money in the pocket means realized health access. Ubrica clinics and hospitals project will ensure physical access to health services. And of course, the science and technology parks built next to the universities are places for translation and commercialization of new and relevant knowledge, ensuring the best quality of medical service in the world. Again, finally, Biomedical Industrial City will promote local manufacturing of biomedical products, reducing the cost of medicines and medical devices and health services in general, making health affordable for everyone. We can do this. We can do this. Let's get together, people, and get the cryptocurrency UBN, Ubricoin for universal health access because it's going to underwrite health production and make health improve in Africa. You can support universal health access by getting UBN in your portfolio of cryptos, get involved, or even getting equity in the Ubrica project. Once again, I will see you tomorrow. Let's continue this conversation, talk about these issues. Thank you, thank you, thank you, and goodbye, goodbye, goodbye.